You appreciate it. Okay. Because we archive it and, we also have it on YouTube. It'll be an enduring record. Once it gets on the internet, it's there forever.
I'll try not to say anything stupid.
Never. Okay. So I think, so we've got 20 people already online and climbing. And the plan, of course, is to have this for about 40 minutes and then, 10 to 15 minutes for discussion. So welcome, everyone, and thank you for coming. As you know, everyone, that our first 2 or 3 grand rounds are hosted by leaders of the institution, with the intent being that they establish the direction for the future and reminisce what has been in the recent past and how we can learn from it and how we can build on it. And our first inaugural talk was by Dr. Gary Butts, and that helped establish the direction that we're going to take this year and going forward on the importance of diversity, equity, and inclusion. And we're lucky to have Dean Charney now, whose real forte, other than the research and leading this fantastic medical school, is resilience, the physiology of resilience, and the practical application of resilience in everyday life. And we thought that in the setting of this ongoing pandemic, not only that hyperacute phase that we faced, but what seems to be like a prolonged phase and maybe more permanent phase, how we use our knowledge of building resilience to cope with this new disease. So as everyone knows, Dean Charney is the Ann and Joel Ehrenkratz Dean at the Icahn School of Medicine at Mount Sinai and is the president for academic affairs for the Mount Sinai Health System. He's a well-renowned expert in neurobiology and the treatment of mood and anxiety disorders, who has made really fundamental contributions from his research to the understanding of human anxiety, fear, depression, and resilience, and has played a key role in the discovery of new treatments for mood and anxiety disorders. Now, if I were to read Dr. Charney's CV or even an abbreviated bio, I would have to have a separate grand rounds for that. So I am going to, he literally is the people who requires no introduction, and I'm going to be literal with that. That is essentially the nutshell of my introduction. He's a member of the Institute of Medicine and the National Academy of Sciences, and has won numerous awards, has done groundbreaking research, has invented innovative therapies, and today will share with us the resilience prescription in times of stress and duress. Dr. Charney, the floor is yours.
Yeah, thank you. And so you asked me to talk about the psychological impact.
Yes. You're on mute now, Dr. Charney. Good, you're good now.
All right. So that's what I'm going to talk about. And hopefully you can see the first slide. Yes. So this is what I call the resilience prescription. And it was based on about 30 years of research where myself and my colleague, Steve Southwick, and the team, we studied the victims of trauma, all types of trauma, everything you can think of from war to natural disasters, congenital disease, every ethnic group you can think of. So we're talking about studying probably thousands of people who we came to admire because many of them were resilient. So we ultimately came up with what we call the resilience prescription based on all this research. And I just want to review that with you because it's relevant to how we handle the pandemic. So first, having a positive attitude, being optimistic, really important. Now, it's not what we would call like a Pollyanna optimism, an optimism that is not warranted. It's realistic optimism that, based on your skills, you think you could prevail when tough things happen to you. So optimism is very important. Number two is cognitive flexibility. That's what that is to, look at what happened to you or look at what you're dealing with and reframe it. For example, if you've been the victim of a rape, it's not your fault. You reframe it and talk and think about how you overcame it, and then you're not going to let it impact the rest of your life in terms of relationships. In terms of what we're dealing with this pandemic, it's tough. You're heroes, many of you, in how you've dealt with the pandemic. It's tough, but you can look back on how you handled it, and it will give you a skill set that you will handle other challenges in your life. Embrace a moral compass. This helps people get through tough times. That when you're facing something very difficult, you have a set of core beliefs in how you behave and how you deal with things that very few things can shatter. Now, for some people, that's faith in the traditional sense, and that works. For other people, it's more of a sense of spirituality and morality that can be very helpful. One size doesn't fit all. One of the groups that we studied and got to know very well were the POWs from Vietnam, who were held in prison for 8 years and heavily tortured. And we interviewed over 40 of them, got to be friends. And one would tell us a story that his cellmate prayed every day and got great comfort from that. But the other cellmate wasn't very religious, but he tried for a year to be religious and prayed every day. But it didn't work for him. Other things worked for him. Very important to have a resilient role model. I'm sure almost all of you can look towards somebody in your life that has guided you and gave you a path on how you handle challenges in your life or what you have become. Very important in resilience. And typically, it's not one person. That you gather skills from multiple people and you incorporate them into who you become. Facing your fears. I'm sure during the pandemic, many of you experienced fear. Fear for your own health, fear for what might happen to your friends and family. That is normal. But facing fear is normal. But you can learn from your fears. How to adapt to that, how to increase your skill set so that more and more your skill set is enhanced so that you're not as fearful. One of the groups that we studied and got to know were the Navy SEALs. And Navy SEALs do some pretty tough things. Among the things that they do is they learn how to parachute out of an airplane in the middle of the night into enemy territory. You don't do that from day one. You gradually do things out of your comfort zone, enhance your skills so that you can face your fears. And that's how you actually develop a toolbox, what we call a psychological toolbox, that can make you become a more optimistic person. I'm going to go through the rest very quickly. You need to develop active coping. We had to do that during the height of the pandemic, not be passive. We all need to have a supportive social network. We need to attend to our physical, well-being. So you may want to hold on to this prescription and how you deal with challenges in your own life. I found it very helpful myself, and Rupa can attest to this because she treated me when I was shot 5 years ago. and I was in the ICU, and I was wondering whether I was resilient. And I found that a lot of things I just mentioned to you were helpful to me as during my recovery. Okay, why isn't this moving? Hold on a second.
Maybe hit enter.
Half out, what's that? Yeah, coming in, okay. I got my help coming in. The slides are not moving.
It's not moving?
Yeah,
Let's see.
all right, okay. Thank you. Okay, so we meaning a very large group of folks that I was involved with, we wanted to determine what was happening to our frontline healthcare workers. What were they dealing with? What was happening, and what were the factors that related to what they were dealing with? And we studied a couple of thousand of our own healthcare workers. So these were the psychological consequences during the height of the pandemic that we found that was happening. That some of our workers, a fair number, were dealing with issues of depression, anxiety, PTSD, burnout. Some experienced what we call post-traumatic growth, that they got stronger as a result of dealing with the trauma. Some of the symptoms were very acute, and others became chronic, and we wanted to deal with that. So this is what we did. We studied over 2,500 of our frontline healthcare workers, and they included physicians, nurses, social workers, almost all of the frontline workers that were facing this deadly virus. And we looked at a lot of outcomes like depression, anxiety, and began to analyze what related to how people did. And then what were we going to do about it? So these were some of the findings. We found that almost 40% of our frontline healthcare workers experienced significant symptoms of anxiety and depression during the height of the pandemic. Major depression, which is a serious problem, generalized anxiety symptoms, and post-traumatic stress disorder. So what accounted for the experience of those symptoms? Pre-pandemic burnout. Now, we know burnout is an issue among many healthcare workers, including physicians. Feeling at great medical risk, having a history of a mental health problem, not being married or having a partner, and that relates to not having enough social support. And you can see some of the other things that related to having acute mental health problems. What related to feeling not so bad? Leadership support. And many of you, are leaders, and how you led was very helpful. If you leaded in a way that was strong, but also caring. Paying attention to your physical well-being. Having a positive emotional coping mechanism. Like some of the things that I mentioned in terms of the resilience prescription, they were related to lower mental health symptoms. What was related to having mental health problems? Not having adequate PPEs, more exposure to COVID, losing a colleague, having colleagues hospitalized, having to make difficult decisions in terms of who you treated and with what, and also feeling that you were not adequately prepared. Some of the occupational factors that you had fewer years in practice, not being valued at work, not feeling support from leadership, not feeling inspired, feeling scared instead. So this shows the actual data that if you had certain risk factors, you had more PTSD, or anxiety and depression. So this is the actual data. In the interest of time, I'm not going to go through that in detail, because I just went over it. And then we repeated the survey many months later. We wanted to see how people did over time. And we found that in general, people started to feel better, but there was a group of our frontline healthcare workers that continued to have symptoms. And you can see here in the red is the first survey that we did, and in blue is the survey that we did a number of months later. So while there was improvement in the number of symptoms or conditions like depression and so forth, but except for burnout, there still were significant issues that we had to deal with. And these were some of the factors that related to having symptoms at both time points. Not being very optimistic, having lower emotional support, not being valued by hospital leadership, having to make difficult decisions about who you treat and maybe who you couldn't treat, worrying about being infected. You can see a lot of these things relate to personal factors, what you're dealing with in your life in general, but leadership is very important. And so for those of you who have leadership roles, how you support your staff, how you care about your staff, how you know about what's going on in their lives can help them deal with the challenges that we have faced during the pandemic. We're still dealing with a lot of burnout, still now. And you could see here that of the people that we asked to complete the survey, that there's about a quarter of the people that are frontline healthcare workers, including, many physicians, many nurses that are having chronic burnout symptoms. And in a little while, I'll talk about what we're trying to do about that as a medical school and a healthcare system. So, what about resilience and post-traumatic growth? I've talked about resilience. Here's a quote from Michael Unger. A post-traumatic growth is a positive change experience as a result of the struggle with a major life crisis. What doesn't kill you makes you stronger. Having gone through this, and I feel very confident about making this statement, those of you who have gone, through the cauldron of dealing with the height of the pandemic, you will look back on this as one of the most important times of your life. And you will say, if I could have gone through that, there are so many other things that I will face in my life that I will be able to handle. That's post-traumatic growth. These are some of the factors that lead to becoming a resilient person, on top of what I've already explained. There is a neurobiology to it. It turns out that certain genes have been identified that relate to a resilient person. We've all, I'm sure you know people in your life that seem just to be able to handle challenges, even from the beginning. I know people from when they were babies and then see them grow up, and they are resilient. They have what it takes, but genes are not destiny. So having some of the other elements that I mentioned, social support, role models, reappraising challenges in your life, all those things can make you a more resilient person. You can train yourself to be more resilient. There's no doubt about that. And we need to incorporate that in how we train our medical students, how we train our residents, how we support our younger faculty. These are some of the factors that we found in these surveys that do relate to being resilient. Purpose in life is very important. Having the sense that what you are doing makes a difference and you're proud of your profession and how you're helping, people to live and ultimately thrive. So you'll have copies of this talk, and you can look at some of these details. Look at the details of these findings, when you have time. But in summary, there are personal factors that do relate to developing mental health symptoms, as mentioned here: previous mental health problems going on in the family, lack of PPEs, losing people to the illness, not having the leadership support, not being prepared. On the other hand, resilience is you can become more resilient and be resilient through a sense of optimism, a sense of purpose in life, having strong leadership, having role models. All those things are important. So that's some of the data we got out of the 2 surveys that were conducted by many members of the Mount Sinai team. And, I should mention John Ripp. He's a lot of it he led, James Morrow. These data are among the most important that have come out of the pandemic. They're all published in multiple journals, as you can see listed here. So, back in March, April, and May of 2020, it became clear to me that our frontline healthcare workers we're going to need emotional support. And this was right at the beginning of the pandemic. And I knew that based on, my own experience in studying resilience and PTSD and trauma over many years. So we needed to do something about it. So back then, we created a Center for Stress, Resilience, and Personal Growth to provide free care, free evaluations for our frontline healthcare workers who felt that they needed help. And we developed workshops and still have workshops available, and they're running now for house staff, faculty, frontline workers, based on some of the things I've already discussed with you, based on a lot of the work, frankly, that I did with my colleague, Steve Southwood. If this is an area you're interested in, this is a book that we have written. This is in the 2nd edition on resilience, and it gives you case examples, inspiring stories that describe how you can become more resilient. And we use that work to create workshops at Mount Sinai that people can participate in to try to enhance their ability to be more resilient. And so we took these factors to incorporate them into the treatment that we are providing. This is a cool book. Admiral McRaven was the head of the Navy SEALs. And I don't know how many of you know about this, but it's called Make Your Bed. In fact, I have a copy here. It's a little book, but if you read it, it's inspiring in terms of how you can become a more resilient person, no matter what you're, whether you're a doctor, whether you're a nurse, and so forth. And I'm going to read it. He says in the beginning, if you make your bed every morning, you will have accomplished the first task of the day. It will give you a small sense of pride, and it will encourage you to do another task and another and another. And if by chance you have a miserable day, you will come home to a bed that is made, that you made. And a made bed gives you encouragement that tomorrow will be better. Now, to be honest, I don't make my bed, but my wife does. So when I come home at night and my bed's made, it actually makes me feel pretty good, no matter what happened during that day.
That is something common between you and I. My husband makes our bed too, so I feel happy about it.
So my recommendation to be more resilient includes making your bed in the morning. or at least have somebody make your bed. So, I talked about this, these are the resilience factors, resilience does relate to optimism. It is very important. Now, I tend to be an optimistic person. That is important, but you need to have the skills to feel optimistic. Contrary to popular belief, optimism does not mean blindly ignoring the problems. You got to look at what's happening before you and say, this is tough. I'm facing something that's tough, but I feel I have the ability to deal with it. I'm realistically optimistic. And these are some of the ways to think about being optimistic in a realistic way. Have a realistic interpretation of what's before you. Cultivate positive and realistic thoughts that you can prevail. Avoid dwelling on negative ones. Be positive. Make your bed. Active coping. Accept what you're dealing with. We're dealing with a pandemic. It's tough. We're dealing with sick people. So we have to accept that. But we can reappraise. We have the skills to help people live. We can learn from our failures. Humor does help. You're part of a team, supporting each other during these challenges. Very important. Understanding your fear. It's, as I mentioned, it's normal, but it's a way to learn how to do things, better. So accept the fear. Don't avoid. Use fear as a guide. Focus on your goals. See the bigger picture. Face fear with support. Learn skills. A little vignette from my own personal life. Helping your children face fears is a good thing. And so when I have 5 children, now 8 grandkids, and raising my 5 kids, we would always go on an adventure trip every year. That was, I would say, semi-dangerous, where I would take my kids and put them out of their comfort zone. And then over time, they would gain more and more skills, so they would be able to do more things. Well, at one point, we were on the top of a mountain. Some weather came in, like a thunderstorm. There was some wildlife that was a little scary. And one of my daughters, who at the time was 13, said that she despised me for putting her in that situation. We still remember that when she said that. And she was a girl who, it took her a while to get used to new things, but I didn't give in to her. And now, she's a PhD psychologist. She's a mother of 2, and she's an outdoors woman. And where does she go in winter? She goes to Yellowstone. So you don't give in. You deal with fear. You face it in a gradual way, so you have the skills to overcome it. And that certainly relates to being a doctor. Physical fitness, very important. Taking care of yourself. Set goals in terms of physical fitness. Get support from others in doing it. Sleep is very important. It's under-recognized. Now, I know in some cases you're not getting a lot, but it is important to pay attention to that. I can't emphasize social support and having role models strong enough. It's so important in how we train ourselves, how we train others, how we can do great things. There's something called the TAP code. We studied the prisoners of war from Vietnam who were held in solitary confinement for years. Imagine that, for years. And they developed a way of communicating with each other through the wall, through tapping. So they had 5 rows, 5 letters in each row. So A, B, C, D, E, and so forth. So if you tapped once, that meant row one. And then if you tap 3 times after that, that'd be the letter C, right? Third letter in the first row. They told us that without the tap code, they could not have made it because they developed social support through tapping and communicating with each other, supporting each other. Many of them became best friends before they saw each other through the tap code. The tap code created a vital social network. We all need tap codes. It doesn't mean tapping through the wall, but it means supporting each other in the right way. And I know in terms of what you all do in a critical care environment, you all need to support each other and have your own tap codes. In terms of your supportive network, know who you can turn to for support, seek out support, and build a network. Role models were very important in my life, both in terms of mentors that I could model my own career, multiple role models where I took certain features from one person than another. I know many of you do that. I encourage you to do it as much as you can, both professionally, but also on a personal level, that you develop role models on how you want to live your life, what moral compass that you have in living your life. It's hard without role models. They help you get through tough times. And I mentioned before, faith, meaning, and spirituality. Now, for some, the typical faiths are very important. In fact, one study that we did with a primarily an African American population, where my research team went to Howard Medical School in collaboration with faculty there. And we wanted to study the patients there who were facing serious problems of abuse and poverty and so forth. And we wanted to understand why some were able to make it and thrive and accomplish great things in their life and others weren't. And we found in that group that faith was very important. Going to church was very important. The beliefs were important in their own right, and the social support that they got was very important. Other folks, find a different kind of faith in terms of spirituality that might relate to yoga or other faith-related activities. So there's lots of forms in which faith and spirituality and belief in something beyond yourself can help you get through tough times. Viktor Frankl is a very famous author that has written a very important book about the meaning of life. He was a Holocaust survivor, and I find these quotes helpful. Those who have a why to live can bear with almost any how. Life is never made unbearable by circumstances, but only by lack of meaning and purpose. That's important. Regularly search for meaning in your daily life. And when facing a challenge, ask yourself, what is life asking of me, or what is life expecting from me? So, to summarize, we have the Center for Stress Resilience and Personal Growth. It's there for you. For those of you who are dealing with issues of depression, anxiety, burnout, it's there for you. But it's also there for you if you feel that you can become more resilient on top of who you are right now. And so the center offers workshops related to each of the factors that I mentioned today. So make use of it. And here's the resilience prescription. So I think we're about, the right time. So I'd be happy to answer any questions that anybody might have.
Dennis,
Sure.
I have a comment, perhaps not a question. Thank you for your very engaging and uplifting and slightly funny talk. I enjoyed it. As I always say, critical care is not for faint-hearted, and we've been fortunate. ICCM has been fortunate for your support and strong leadership, in addition to the faculty body that's highly resilient and well-rounded. I was a little surprised to see that male gender is associated with greater resilience in your was wondering what are your thoughts. I would have, for some reason, thought the other way around.
Yeah, that came out of the data. So you could possibly speculate, whether whether females are not reaching out enough, they're not supporting each other enough. They don't have prior experiences to help them get through tough times. But it would be just speculation that just came out of the data. Maybe there are issues in our own field, as physicians, where female faculty are not getting the same, level of support. That'd be a very disappointing, fact, but we have to look into it.
Perhaps the added responsibility of home and work.
That's definitely a factor where, particularly during the pandemic, where our children were staying home.
Yep.
And a lot of the burden fell on mothers to do everything, to work and to take care of the kids who were missing out on school and needed a lot of support at home. So that could very well be one of the factors.
Thanks, Dennis.
Yeah.
I have a question. Thank you, Dr. Charney. This is an incredible talk, and I wasn't sure what to expect. I've had the fortunate of hearing a similar talk from you, Dr. Charney, a few years ago, long before the pandemic, and I see a very different perspective that maybe the pandemic added to it. I don't think this talk is you're going to find a better audience for this talk, and will appreciate this talk than us because of the experience that we had, in addition to the burnout that the highest among the intensive care physicians. So it's almost every slide I found something that I can relate to and resonate with our experiences as well. So thank you for that. Among the prescription and the factors that you mentioned, if we have to rank them, what would be the most important or the highest, most contributing factor to contribute towards our resilience? Or is it individual, based on individual basis?
Yeah, it's individualized. So one size doesn't fit all. And you might look at, say, this list that we developed over many, many years, and think about yourself and what would be most helpful to you, and what elements that you think, well, you got that help, but there are some factors that you could work on. So it's very individualized. When I got shot, so my personal experience, I developed this before I got shot. So I may have told Rupa because she was taking care of me. So I get shot, and I said to myself, one, am I resilient? And two, did this resilient prescription, is it right? Does it work? And I did find that, frankly, that it worked. It helped me, and some of the issues that we had identified were helpful to me in my own recovery. Like being optimistic that I was going to recover. I felt I could recover. I had an incredible supportive network, both in terms of my family and the doctors that took care of me. I set goals for myself right away when I was in the ICU. You know, that in 6 months, I was going to be able to do this. I was going to be able to do that. And that I found that very helpful. What's helped me during the pandemic, I wasn't on the front like you all were, but I was here every day. And I felt it was very important as a leader that people knew that I was here every day and would provide the kind of leadership that would be helpful. And the reason, and frankly, I did not find that hard because I had prior experience with facing challenges. So your prior experience helps you become more resilient. And that's why I feel very strongly that all of you that, have had to deal with and deal with, a crisis in terms of what you do every day, that makes you a stronger person. You develop a psychological toolbox that helps you deal with many other things that you face in your life.
Thank you, Dr. Charney. And the leadership piece, it's very, very critical. And I would like to share that during the midst of the fog of the COVID and not knowing what's coming next, for me and for a lot of my colleagues, the fact that we were together and seeing each other every day, dealing with the same issues, and we see the leadership, whether it's Rupa or the hospital leadership and Dr. Rich, shoulder to shoulder and coming and checking on us, we're feeling there is something, if we have to fall, there's something we can fall back on. And we can reach out to it. I think seeing all the colleagues together at the same place, dealing with the same issues, was encouraging and maybe contributed to our resilience. And
it definitely did. It was amazing. And we have, I don't know if did I mention this? We have a book coming out.
No, you didn't.
That we hired a writer to document what you all did. And it's been completely written. It's called Relentless. I think that's a good title. And it's going to be in bookstores.
We're looking forward to it. Thank you.
Yeah.
Thank you, Dr. Charney. What a wonderful review. And like Adele, I remember your resilience discussions before COVID, what I call the era, BC era, and updated to now. Now, one of the downsides of these crises is obviously that we face the crisis, but this crisis is all consuming. It takes up all your bandwidth. It takes up all your time. And how does one accommodate such a comprehensive prescription at a time when your entire space is occupied by something that massive?
Right. You can't let that happen. So you do need, and that's partly what we need to make sure as leaders, you do need time off. And, number 8 there is attend to your well-being. And that means having time off, taking care of yourself mentally and physically. And you can't do it every day, day after day after day. You do have to decompress and come back for another day. And so if you don't do that, you're going to become exhausted. So you know about that. And you're going to become less effective. And you're going to make mistakes. So you have to do that. If you don't do that, there are bad outcomes. And don't think you have to do it every day. Don't feel guilty if you're taking time off and attending to yourself and your family.
Yeah. Very good. Does anyone have any questions?
Yeah. Dr. Charney, my name is Rupert. I'm one of the intensivists. Thank you for this really great talk. I just wanted your thoughts on social media And resilience, social media over the last few years has been associated with a lot of issues in terms of seeing everybody else's lives perfect and adding to anxiety and everything. But there's this strong counter movement that we see about certain figures in social media talking about their mental issues and being like showing what reality really is and becoming role models. And I was just curious on your thoughts of how social media would figure into these things for the good or the bad.
Good and bad. Frankly, I'm not on Twitter and so forth. In part, I don't want to know what people are saying about me, but there are the positive about social media. If you can use it in a way that you're getting real positive social support, like many social media group where you're sharing ideas and you're providing support, that's good. But then there's a social media that people say things that are ridiculous, that are critical, that can bring you down, even when they're not true. And so that's a big negative. And we're certainly finding, and there's reports about this in the last couple of weeks, that social media can, particularly in younger people, are increasing the rate of depression, anxiety, and even suicidal thoughts, because anybody could say anything that can be very critical and decrease your self-esteem and so forth. So if you're going to utilize social media, do it in a targeted way and in a way that you think you're going to get social support or professional support, and not place yourself at risk to hearing things that make no sense and are critical.
Thank you. Dr. Dangaj?
Thank you so much, Dean Charney. What a fantastic talk. And there were so many themes that you hit upon. And when we look at this resilience prescription, so there are big things and small things that are happening all around us that are changing us as people and as physicians every single day. How do we take the time to process what's happening, both big and small? Going back to Umesh's question, there's so much that is all encompassing, that's massive, that's happening around us, that's changing us. But every single day, there are little things that are happening that both give us meaning as well as that erode some of that meaning. So how does this resilience prescription, in your experience, evolve over time? And what can we do intentionally to pay attention to how we're changing?
Yeah. So what I have found, helpful, because a lot of time in my job that happens, right? A lot of things going on and so forth. Look at number 2 here, if you can see it. What we call cognitive flexibility through cognitive reappraisal. And in a way, you step back and look at what's actually happening and focus on what's important and don't focus on the trivial. So this says traumatic experiences, but you can take out the word traumatic, that you can reevaluate, what's happening and look at the perceived value and meaningfulness to it. Step back. How important is it? What is the meaning of what is happening? And you can reframe it. Here it says reframe, right? Put it in perspective, accept it, because there might be some things that you can't avoid, and then recover. And you can substitute the word grow. So part of it is stepping back, evaluating, reframing, assimilating it, but focus on what's important and not on the small stuff.
George, Dr. Ofori Amano.
Hi, thank you, Umesh. And Dr. Charney, thank you for this really amazing talk. Every time I look at this prescription, the resilience prescription, it just puts into perspective what we all went through with this pandemic. And we look back and sometimes we think that having gone through this should actually make us feel more prepared in the event something like this were to happen again. But right now, in talking to my friends in Texas, Florida, who are going through this surge, there is this fear and anxiety associated with this increasing COVID incidence. So I wonder how best we can take this prescription and kind of transform this feeling of angst into a feeling of more mental preparedness for a surge, if that were to happen, or even any other pandemic were to happen.
Yeah. So one thing we're doing, the center that we formed, the Center for Stress and Resilience and Personal Growth, we have recently sent a letter to all of the literally all the deans and medical centers in the places where there's a surge, and we're offering them consultation for free, whatever they need, to share our experiences of what we have gone through, because they're in the middle of it now. And we feel we can provide some guidelines on helping them, get through it. And as you saw in our survey of our frontline healthcare workers, right in the middle of it, right? The first survey, there were factors that related to not having major symptoms of anxiety, depression, and so forth. And it included being prepared, having PPEs, having leadership and role models. So in the middle of it, it's tough, but we can provide help to them, and we're trying to do that.
Thank you once again, Dr. Charney. It's a pleasure to have had you here, and I think all of us can benefit from what we learned today. Have a good day.
Okay, keep it up. Thank you. Thank you for what you do.
Thank you.